A UNLV medical student tells me a shortage of residency opportunities in the Silver State could not only be leading to the state's shortage in doctors, but could also be worsening the COVID-19 death toll.
My family is here. I want them to have good health care. And in order to have good health care, we have to train the resident physicians.
UNLV medical student and Clark County native Lauren Hollyfield is finally in the home stretch.
And we'll be graduating in a little bit more than 100 days.
Now she's in the thick of applying for her postgraduate medical residency.
Residency is a period of time anywhere from 3 to 7 years where you really hone in on the skills of whatever specialty that you chose. And then once you finish residency is when you can establish your practice or join a practice that's already established in whatever location that you choose.
But she says Nevada doesn't offer enough residency programs and positions, making it tough to stay in her home state.
My dad's actually an ophthalmologist here in town, and if I decided tomorrow I wanted to follow into his footsteps in ophthalmology, I wouldn't be able to here in Nevada, at least. There's no ophthalmology training program.
She says some programs around the country accept up to 28 residents per class, whereas most programs in Nevada accept between 5 and 15. This forcing many students to go to other states.
We also don't have all the specialties represented, so we don't have dermatology here.
Touro University CEO Shelley Berkeley says this is a big reason for Nevada's doctor shortage.
The national statistic is that 70% of doctors end up practicing where they do their residency.
And that doctor shortage is apparent in the data. A 2020 report by the University of Nevada and American Association of Medical Colleges shows Nevada ranks 48th in the country for primary care physicians per 100,000 people. This shortage, Hollyfield says, could inadvertently be impacting our COVID-19 death toll.
I think there's a link between having chronic diseases and not having them well controlled and having poor outcomes with coronavirus.
So why the residency shortage? Berkeley says it's very costly to create these programs, and that's why the hospitals have a challenge in creating them by themselves. Nevada's legislative session starts in just a few weeks, and in budget talks, Berkeley says she hopes legislators will consider funding more postgraduate training programs, but she worries it'll be unlikely. I'm Maddie White, Fox 5 News, local, Las Vegas.